Welcome back here, 7:22. So if you see a lot of people wearing red today, it is for a very good cause.
Heart disease is the #1 killer of women,
killing more women than all forms of cancer combined.
This is an ad put together by the American Heart Association. National Wear Red Day aims to raise awareness of heart disease among women. The American Heart Association says heart disease and stroke killing a woman every 80 seconds, and those statistics are just staggering. But experts say a vast majority of these events really are preventable.
So here to tell us about how you can lower your risk of heart attack and stroke is Dr. Hwang, a cardiologist at Virginia Mason. Good to have you here this morning.
Well, thank you for having me.
So February is Heart Health Awareness Month. Why is it so important to bring awareness to this issue?
Well, heart disease simply is still the #1 killer in America. It's estimated somewhere between 1 in 3 deaths in America are from either heart attack, stroke, or something cardiovascular in general. So it's very prevalent. Because it's so prevalent, it's really important for everyone to understand what their individual risk profile is so that they can enact on it and do something about it.
Let's talk a little bit about that risk profile. What do people need to look for in their own health, in their family history that could put them at higher risk?
That's a great question. So I look at it as both modifiable and modifiable risk factors. So the non-modifiable risk factors, you can't really do too much about. So your age. So the older we get, the more likely it is that you may develop heart disease. Family history, you can't do much about your genetics. You can't pick your parents. But the modifiable risk factors, you can do something about. Smoking, diabetes, hypertension, high blood pressure, high cholesterol, and obesity. So those are the modifiable risk factors that we can do a lot for.
What are some warning signs of a heart attack, and are the symptoms that you might see different for men and women?
Yeah, so I think most people these days recognize that chest pain is the most common presentation for both men and women. But what a lot of people don't realize is that it's not really just a sharp chest pain. It's actually more concerning and more worrisome if it's a chest tightness, pressure, heaviness in the substernal region. Oftentimes it radiates to the shoulders, the left shoulder, the left arm, the jaw, the neck region, the upper back. So those are more worrisome features. Sometimes, however, you don't experience any chest pain at all. And in women in particular, the symptoms are more subtle. It may just be shortness of breath. You feel like you're not getting enough air when you're going up the stairs or going up the hills. So we have to be attentive to that. Sometimes the symptoms are even more subtle. They could just be fatigue, nausea, vomiting, a feeling of diaphoresis, what we call just sweating for no good reason. So all these presentations are very unique. It's very subtle sometimes, so you have to have a high index of suspicion, especially if you have risk factors.
Now I'm just thinking about the people who are waking up right now. They might be eating breakfast. You mentioned obesity is an issue. We all have the New Year's resolutions to lose weight and make better eating choices. If someone's sitting down for breakfast right now, what's a good choice for their heart health when it comes to let's just start with breakfast food? I mean, what kind of choice should they be making right now?
Yeah, so the right diet and exercise program, what we call therapeutic life choices and therapeutic life changes, is very important. That's the most important thing. From a dietary perspective, I actually don't even like to use the word diet. It's just using a healthy eating pattern. So what does that mean? It's a couple of different principles. First is reducing caloric intake. So in America, we just tend to eat too much, so we need to reduce portion size. Reducing sugary beverages, so sodas, sugary foods, candies, we got to eliminate that. It's all bad for you. Reducing your intake, or just eliminate processed foods in general. Anything that's processed meats in particular are very bad for you. Reducing trans fats, saturated fats, fried foods, things of that nature.
So all the good stuff, basically cut all that stuff out.
If it tastes good, it might not be good.
Yeah. Lots of fruits and vegetables. If you are going to consume meat, baked meats, chicken, fish, reduce the amount of red meats significantly.
Great information. Dr. Hwang from Virginia Mason, good to have you this morning.
Pleasure to be here. Thank you.
All right, 7:20.